I have spent tons of money on treatment of my beloved. Money was flowing like water. The person got cured, but I am not satisfied with the results. Have you felt this in your life? Or have you heard these words earlier? If you feel that this has happened during the treatment of someone in your family earlier, then believe me, you are not alone. So let us discuss how we can prevent this as a doctor and as a family member. Hello everyone. This is Dr. Piyush Gupta and I welcome you all to my YouTube channel Ask Dr. Gupta. Today we shall discuss that why there is dissatisfaction in the patients and their families after treatment and what all can be done to prevent this. It is very common to hear that we spent money in a large quantity. It was flowing like water. But we were kept in dark. We did not know whether the treatment going on was right or wrong. We did not know whether the medicines that are being procured are actually being given to our patient or not. So believe me, you are not alone in this dissatisfaction. I had a chance to get two of my very precious family members treated in large hospitals. So I shall try to decode this, I shall try to solve this puzzle both as a doctor and as a worried and puzzled family member. So we shall find out that what is the problem, and what I have realized it that the family as well as the doctors and the hospitals, the healthcare system, both have their share in this problem. So the first and foremost reason is that the expectations of the family are sometimes very high. They are so high that sometimes they become borderline unrealistic. I will give you a couple of examples. First is the plastic surgery. When I treat a patient and I say that I will have to remove a part of your body, then the family demands that can it be remade using plastic surgery? This is because the advertisements and the film industry has created an impression that my face can be put on anyone amongst you and that person can come and sit in my OPD and see patients. This is the impression that has been created about plastic surgeons. Or anybody who is very ugly will become very beautiful because of plastic surgery. This is not entirely true. Our expectations should be realistic. What a plastic surgeon can do, that they can put the stitches in a location where they are not easily visible. These stitches put by plastic surgeons are finer, but they are stitches. They are visible. Another example is that a very aged person who is having multiple other problems like heart disease, like diabetes, and they come to the hospital and the hospital tries their best, but the family thinks that the person will start jumping and walking maybe in a couple of days. And I have seen in a family around me where a 93 years old lady who was having multiple problems was admitted in hospital because of whatever reason, and whenever there was something negative in the treatment course, then the family became very apprehensive, very dissatisfied and borderline aggressive. So we should accept that a 93 years old person who has multiple problems may not be able to tolerate even a simple diarrhea. Plus there are stories of unjustifiable admissions, of fear mongering going on in hospitals. These are more prevalent in some conditions like accidents, like heart diseases. And we have seen it during recent corona pandemic when there were stories that the patients who could have been treated at home were admitted to the hospital when there were huge bills. The reasons for these high expectations are because the cost of treatment is going up. So the family thinks, the attendants think that the results should be proportionate to expenditure, which may not be true. The dissatisfaction is more commonly seen in case of patients who are paying out of pocket. Plus there is one more thing, that many people are eternally dissatisfied. Do whatever good happens to them, but they will not be happy. One example, that the state governments are changed many times after every 5 years. So the same person who was a bad chief minister today becomes a good chief minister 5 years later, because we are now unhappy with the person who is incumbent. So we should come out of this eternal dissatisfied mindset. There are different type of facilities available in government sectors and in private sectors. Today the public healthcare system is expanding very fast. So we have different set of problems for private sector hospitals and for government sector hospitals, and there are different reasons for them. When it comes to public hospitals, to government hospitals which are either free or very heavily subsidized, There the problem starts that they are congested. There are a lot of people all around. We did not have a place to sit in the OPD. We are finding it tough to get a bed. In addition to congestion, the consequent unhygienic situation is also very often complained of. The next complaint is that the behavior of staff. The doctor didn't give enough time, the nurse was in hurry, the fourth class staff was not polite. This kind of problems. We should understand that the congestion is because not everyone can afford costly treatments in private. So even after that much expansion of the public healthcare services in recent past, there are still more patients than they can be catered by the existing system. The staff behavior is because many times they are overworked, so a doctor may not be able to give that much time as much you demand, because he can see 25 patients standing behind you. Another complaint is that in government hospitals it is the junior doctor who does everything. Remember, these are done under supervision. Junior doctor is doing it on behalf of his senior, and this is being done under supervision. Most of the complaints that come are because of lack of attention by the person who is attending. Many a times it is because we are having a fear, we have a preoccupation in our mind that the government hospital people pay less attention. But sometimes this is true also, and we should try to understand their problems. But yes, this is the problem that we face in government hospitals, or the kind of complaints that we get from the people who are getting treated in government hospitals. The problem is because there is enormous workload, plus the solution to problems coming in government hospitals is not very fast. For an example, if the CT scan machine doesn't work, in that situation, if the machine needs replacement or a major repair, in that condition, the government hospital will be getting sanction for money from higher ups, maybe up from the ministry, and that takes time. Unlike a government hospital where they will be a private hospital where they will mobilize everything and get it done overnight. Now we see the private hospitals. They have a advantage that they have less number of patients. But the allegations or the points of dissatisfaction are that they are expensive. The senior doctors, they hop jobs like a person in any sector. So you get treated by a doctor today, you go to the hospital 1 year later and you will find another doctor sitting there. So you will miss the doctor who was sitting in that chair 1 year earlier. It is also alleged that many a times the hospitals in private sector, instead of being treatment oriented, they are revenue oriented. They are true allegations or false allegations can be a topic of discussion, but these are the reasons for dissatisfaction. There are allegations of unjustifiable admissions, which unfortunately are true sometimes, and the drugs being costly. Many, if not most of the complaints in these hospitals, maximum complaints are about housekeeping, about the food quality. But we should remember that a beautiful hospital, a 5-star hospital, need not necessarily be a 5-star hotel. So what actually we are looking for at is that the demand is for level of care which is provided by private hospitals, which are having much less number of patients, and the charges should be of the government hospitals which are having financial crunch. So we cannot have best of both the worlds, and this leads to resentment, to dissatisfaction. The patients who are spending from their pocket are more watchful, and I am very happy. I always encourage my patients to be watchful. They inquire about the qualification of the doctor who is treating them, about the specialization of the doctor. They also check the quality of medicines that they are paying for. I myself tell my patients that please check the spellings of the drug that you are buying, so that you do not get a spurious drug or you do not get a substandard drug. But in case of government hospitals, where the doctor is appointed by the government and not picked up by the patient, where the drugs brand and everything is picked up by the government by tender process and not out of choice by the buyer, this kind of dissatisfaction remains. On the other hand, the insured patients who are not paying at that moment from their pocket, or those people who are beneficiaries of various government schemes like CGHS, like ECHS, like Ayushman Bharat, they are generally content with the fact that they are not paying from their pocket at the moment. So there are different reasons, but having seen the reasons for discontent, now can we have some way out? So we shall start with one by one, and like I said that there are problems from both the sides, from the service provider as well as the service recipient. So I will start with the problems that are probably lying in the families and in the patients end. So do we have a way out? First thing, First thing is that we should remember that a big city and a big building may not necessarily mean better treatment. There might be a gem who is sitting just next door. You ignored that person and you reached a big center and you got dissatisfied because the person next to you was better. I will give you one illustrative example. I have a doctor friend who is from Badaयूं. He told me that in his city, it is not important whether the doctor treating you is a MBBS or is a MD, is a specialist or is a general practitioner. But what important thing is that whether the person is being treated in Badaयूं or in Bareilly. Bareilly is a big city near Badaयूं. So we should come out of this mindset and then we shall have much less dissatisfaction. We should understand some basic facts. First is that infrastructure is important, but it is even more important that who is the person who is using that infrastructure, who is providing you the facilities. Like we take an example of a car, we might be having a cheap car or we might be having top of the line, the costliest car. The costliest car is definitely better, has better features, comfort wise, safety wise. But the most important person is the driver. You will be more safe in the hands of a good driver in a cheaper car than in the hands of a rash driver in a costly car. It is even more important for the patients who are beneficiary of any government scheme, the so-called panel patients, because it is a tendency in the part of the hospitals to hire a doctor who charges less, even if it means sometimes compromising on the competence because they have to work under fixed packages. So we should find out a doctor first, that which doctor is most suitable for us. And then we should find the hospital where that doctor can treat us, which hospital is empaneled hospital under that scheme. Are the small hospitals ill-equipped? This may not always be true, because we should be concerned about the treatment of the disease that we are suffering from. So if I have a blood pressure problem to be treated for, then we should not be concerned about the fact that the hospital doesn't have treatment for bypass surgeries. We shall find a suitable hospital for bypass surgeries if, God forbid, we land in a situation. But today we have a problem of blood pressure. So if the doctor says that you get admitted to this hospital, that means the doctor is treating these patients there regularly and he is comfortable there. And believe me, a relaxed doctor is one of the most important factors in the decision of outcome. Because if a doctor is working at a new place that you asked him to come to, then he will be stressed because the staff is not tuned to him. He may not be able to contact the appropriate staff that is needed for a person. If there is a complication, then staff might not be able to contact him immediately because he is not a regular there. They might not be having his contact details. So if you are being told to go to a hospital, then find out whether the facilities for your condition are present there or not. Forget the otherwise infrastructure. If there is a doctor which is known to you, then this is the best thing that you can have, because this gives you personal attention that no money can buy. I myself got my father's bypass surgery done 1.5 years back in the city of Jalandhar, which is more than 400 kilometers from my place, while I could have got it done in Delhi, and being a doctor I could have got personal attention there also. But the doctor in Jalandhar was very well known to my family. I knew his competence, and 5 days after the surgery my father traveled all the way back from the city of Jalandhar to our city, 420 kilometers in car, not in ambulance. This is a big thing, because he was satisfied, he was happy. Medium hospitals generally have more satisfaction rate than small nursing homes and big hospitals, because they are very well equipped as compared to small nursing homes, and they are much more cost effective as compared to large corporate hospitals. Specialized medium hospitals are even better, because there the infrastructure is tuned to only one condition, like maternity homes. So they are very well equipped to handle the newborn. They are very well equipped to handle the delivery lady, the lady who has gone there for delivery. So they will give you better outcomes than a general hospital that is attending to every condition, where a person on emergency duty should be comfortable attending every emergency. Here the person is attending only one problem. If the treatment is being done in your city, then it simplifies a lot of the things. For example, in a city away from your home, you have to arrange even the morning cup of tea. And in your city, a lot of things happen without any effort. Generally, the doctors that do not have their own hospital have better satisfaction rates than those who run their own hospitals. The reasons can be anybody's guess. Now the question is that when we say that we should pick up a doctor first, then which doctor we should go to? So we should ensure that the person who is being entrusted with our treatment of disease actually knows how to treat this disease. I have seen that a lady who had a problem in thyroid was operated for her abdomen because the doctor was not comfortable in thyroid surgery. So a minor problem in abdomen was attended first, ignoring the thyroid problem. Similarly, I had seen a patient very recently who had a lymph node mass in his neck and in his tummy also. The doctor was uncomfortable operating in neck, so he opened the abdomen and took out a lymph node for biopsy. So in this situation, I will say that an unnecessary and complicated procedure was performed because the doctor was not comfortable doing the procedure that would have been good for the patient. So how to avoid this situation? The prescription that you can see now is from a general surgeon who tried to treat breast cancer. The chemotherapy protocol that is shown here is not found in medical oncology books. I discussed with a lot of medical oncologists and nobody endorsed this. They say that this is something which is not given in breast cancer. So why? Because the doctor probably randomly picked up some medicines and he knew that these are anti-cancer medicines without knowing that what is the protocol started this. So this is a very unfortunate situation. This should be avoided at all cost. And believe me, a specialist does everything better. So better to engage the specialist of that particular illness. There is no foolproof method to ensure that you get the best doctor. But at the same time, there are some certain precautions, there are some suggestions that can be followed and we can probably have a better result and less dissatisfaction. First thing is that the specialization of the treating person, of the doctor, is written on his nameplate. Like on my nameplate is written that I am a cancer specialist. So you know that I can probably treat cancer better than a person who is not a specialist. And remember one thing, that one person cannot be a specialist of every disease. So if a doctor's plate says that he is a specialist of this, that, blah, 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 that means that the person is actually general practitioner. At the same time, we should also see the institute the person has been trained at. So a person who is treating eye, an ophthalmologist, an eye specialist, who has been treated at Shankar Netralaya, or a cancer specialist treated at Tata Memorial Center, or anybody who has taken his training from All India Institute or from PGI, they are likely to be among the better doctors. But at the same time, this thing gives only a positive assurance. If this is not present, it does not mean that the person you are engaging is a bad person. But if you have this factor, that can be positive reassurance that you are probably in safe hands. But at the same time, don't write off anybody simply because that person does not fit into these criteria. Like the Chief Justice of India is not from National Law University. So National Law University is good, but doesn't mean that only they are good. Similarly, these institutes are good, but doesn't mean only their products are good. You can ask from other patients who have been treated. They will give you very honest feedback about overall experience of treatment. You can also ask a doctor that you trust that which doctor should we go for treatment of this particular illness. Like I am a cancer specialist, but I do get patients who come to me for suggestions about a doctor, even for a tooth extraction. One more criterion is the number of medicines a doctor writes. The prescription that we can see here had gone viral at the time of corona pandemic, and you can see the number of medicines. Even the hospital staff and the doctor will forget that what all medicines have been given today and what all have been not been given, have been skipped, because there are so many. The reason was that the doctors were clueless at that time. There was no known cure to corona pandemic. The prescription that I can see now comes from a dentist, and this is about aphthous ulcers. Aphthous ulcers are ulcers in our mouth that actually do not have any established treatment. So many medicines are being given. So if your doctor is writing less medicines, then it means two things. First, it shows the confidence of the doctor in his diagnosis and in his treatment. Second thing, it also shows that you are not suffering from too many illnesses. You are a relatively healthy person. Online searches, online ratings, online grades, online ranks, and newspaper insertions, they can be manipulated. So don't give too much importance to them. You might be misled. One more thing, that the busiest doctors may not be the best option. There is a tendency to go to the busiest under a good impression that yes, since so many people are getting treated there, so it means that the person must be good, and this is mostly true. But remember, a person who has to attend 20, 30, 40 patients in a day may not be able to give that much time to individual patients as compared to a person who is attending 8 to 10. There are instances where the busiest surgeons, they have 3 to 4 major surgeries being performed every day, which is physically impossible for a human being. And if you closely watch, then you will see that in the consent that you have signed, it is written that the procedure will be done under overall supervision of that particular doctor, not by that particular doctor. So It is inevitable in case of institutes, because they have so many operation theaters, and these are teaching hospitals. Resident doctors have to operate under supervision. That is how the system builds up, that is how the specialty grows. But if it is happening too often, it is happening in private, then you should be alerted, because you engage one craftsman and you are being treated by another one. The other one may be even better, but it is not the person that you had engaged. In pandemic time, I have seen that there were 80, 100, 200 admissions under one doctor, and forget the name of the patient or the well-being of the patient. The doctor sometimes even did not remember that how many patients of mine are admitted in this hospital. So this is inevitable in case of an epidemic. But if it is happening in routine, then this is something I will say you should avoid. Next is that what do we do if we have a new doctor, the person who has just come to the city? So are new doctors bad by this yardstick? The answer is no. When you meet a doctor for the first time, you get a reasonable idea of what kind of person you are dealing with, whether the person is confident about his diagnosis and treatment or he is confused. You can also ask the doctor who know that person. Like when I came to this city, there were practicing senior doctors in the city who knew me since my residency days. So they gave positive recommendations because they knew me. Similarly, an institute recommends their alumni. There are many situations where our institute, the Tata Hospital, used to say that we have a long waiting list here. You can go to the city. We have a person who has been trained in this hospital, and he will treat you equally well. Plus, ask those who have been treated. The sample of those treated by that particular person might be small, but there is definitely a sample. After we have done this much homework and we have decided that this doctor is treating me, then please trust the person you have shortlisted. Don't run around seeking endorsement from others. You will get confused. Either you trust the person that you are getting treated by, or you walk away. There is no point walking along and having doubts in your mind. Please avoid hearsay. This will simply complicate the matter and confuse you. You will be having unnecessary fears in your mind. Second and third opinion are always encouraged. They are very good, but it should not translate into wastage of time. You take second and third opinion, but do this within a couple of days, or at maximum within a week. Don't waste a month taking second, third opinion. If you have been advised bypass surgery, then you need bypass surgery. Don't ask 10 people with a hope that 10th person will say that you do not need it. You actually need it. You are wasting time. The condition of the patient is deteriorating and the result will be worsened. In medicine, remember, 2 plus 2 do not always make 4. 2 plus 2 can be 0 also, 2 plus 2 can be 22 also, and they can of course be 4. After all this, we should have one thing very clear in our minds, that every doctor puts his best effort in treatment. And results are not mathematical. It is not proportionate that this much input will lead to this much output. A lot of input may not translate into results, and a little bit of input can give you very good results. So it is not mathematical. Surprises are rule, they are not exceptions. And these surprises are pleasant, they can be unpleasant also, but they do keep on coming. So you pick up a doctor, pick up a hospital, and then have full faith in them. If there are any real issues, any real problem, then the best is to sit with your treating person and clarify them. Adverse outcome does not mean bad treatment, remember this. Finally, for the families, I will say, don't get carried away by newspaper ads and highway hoardings. Don't rush to the fanciest and the glossiest. They may not always be the best. Have faith in the man that you have picked up after that much of hard work and that much of filtration. Have faith in God, and remember, the results will be good. After this, I have a few words to say for my colleagues, for the doctors, that when you go to a patient, please be well dressed and smile. The patient is in trouble. If they see a shabbily dressed person whose beard is unshaven, then they will not feel good. If you are smiling, you look bright, your face shines, then the patient will feel better. Whenever there is a situation that you do not like, then please remember that the family is puzzled. So do respond, do not react. When you are informing the family about the treatment, this is very important for surgical patients. Please do not hide the potential complications. The consent should be detailed. Don't fear running away from informing the family, and there are demands that the patient should not be told about it. He will get scared. Then remember, if the person is getting scared by the thought of a complication, what will be his reaction? What if, God forbid, the complication actually comes? So if there are any unreasonable demands from the hospital or from the family, you should firmly say no. And whatever is being happening with the patient, keep a check on this by yourself. So if you see that the bed sheet is not clean or the dress needs change, then before the family asks for it, ask by yourself. This will make them very happy. This will show that you actually care for them. So care should be shown. And also remember one thing, that unethical act do not remain hidden forever. So having said all this, I wish everybody who needs treatment, who is in need of treatment, all the best for their recovery. Thank you.